Welcome to the Peds NP, Pearls of Pediatric Evidence-Based Practice. I'm your host, Dr. Becky Carson, pediatric nurse practitioner and faculty from the Duke University School of Nursing. And I'm so honored to introduce a new series based on the Choosing Wisely campaign from the ABIM Foundation on behalf of the American Board of Internal Medicine. You may recognize this series from my talk at NAPNAP's 46th Annual National Conference in Chicago, where this case-based discussion offered new insights into resource stewardship and evidence-based practice. So I'm bringing it to everyone in podcast land, complete with peer review from my colleagues using our standardized approach to quality assurance. You can learn more about the peer review process at thepedsnp.com/peer review. Let's get started with our Choosing Wisely series using our typical approach to practical learning, adorned with pearls of wisdom from the scholarly literature. That way, you can build functional skills from this discussion that can translate to your competency-based education and clinical practice. We'll begin with a few learning objectives. We're going to learn about the Choosing Wisely campaign, its historical precedent, and its goal. Then, in each of the 5 following case-based episodes, you'll hear common presentations from primary and acute care pediatrics. In each one, we'll apply concepts from multiple Choosing Wisely lists to help guide your management and remain a good steward of resources. And lastly, because making decisions requires a family-centered approach, I'll also talk with you through some of those tough conversations to create allies out of nervous parents or colleagues who want to do more, especially when it's contraindicated by the evidence. Let's get started with the Choosing Wisely campaign and how it came to be. Overuse is a healthcare service that is provided under circumstances in which its potential for harm exceeds the possible benefit. This simple proverb from the Institute of Medicine National Roundtable on Healthcare Quality can be whittled down into an even simpler motto that you undoubtedly recognize. More is not always better. The ABIM Foundation tells us that 20 to 25% of tests, treatments, or procedures that providers order for their patients have no benefit. They don't help patients get better, so their inclusion adds to medical waste. Or the test may even be contraindicated because it's more likely to cause harm. This inspires me to add my own little motto. Just because you can doesn't mean you should. Here's a current example you undoubtedly recognize, but probably haven't quantified. CT scans expose patients to radiation. We know this, and therefore we know that we should use them more judiciously. A 2025 study by Smith, Bindman, and colleagues in JAMA Internal Medicine created a risk model for patients receiving CT scans and found that CT scans could be the etiology for up to 5% of future cancers. And that's especially important to note for children and adolescents who have greater risks because they have long lives ahead of them in which they can develop cancer. Just because we have the technology doesn't mean we should. We need to weigh the risks and benefits of an intervention, along with our foundational knowledge of pathophysiology, diagnostic reasoning, and clinical judgment. Take a little walk down history lane with me to understand how we got to this place. The Choosing Wisely campaign has its origins in an editorial circa early 2010, right on the heels of the 2009 financial crisis. Dr. Howard Brody is an MD PhD who published the editorial, Medicine's Ethical Responsibility for Healthcare Reform, the Top 5 List, in the New England Journal of Medicine. In the piece, Dr. Brody points out the compromises made by nonprofit industries and pharmaceutical companies to support then President Obama in healthcare reform. But then he shows the moral mirror to readers, placing accountability for the skyrocketing healthcare costs on physicians, and I'll go on to say all providers, who failed to adhere to evidence-based guidelines that would limit unnecessary tests. He reminds us of our commitment to patient interests, not our own financial interests, and called on the U.S. medical specialty societies to identify 5 tests and treatments that were overused in their specialties and did not provide any meaningful benefit for patients. These lists needed to be complete with implementation and education plans. As I was giving this talk at NapNap, I took a poll of the pediatric-focused nurse practitioners in the room and found that about 75% of participants had not even heard of the Choosing Wisely campaign. And while the educational session would certainly select for people who didn't know about a topic, those results confirmed my beliefs for why I submitted the abstract in the first place. Although there were nursing organizations at the table, my professional organization was not listed as a partner on any of the pediatric lists we will discuss. How will anything get done without nurses? Pediatric-focused nurse practitioners are a huge part of the pediatric workforce in primary and acute care settings, and we have the prescriptive authority to order or not order these tests, treatments, and procedures too. Nurses are the backbone of healthcare, the most trusted profession, and yet excluded from so many important conversations. So this is my call to the next evidence-based efforts by any foundation or society. Include nurses, especially advanced practice nurses. Include leaders, entrepreneurs, scholars, and trailblazers. We will help you bring this practice to the bedside to make better care for children, their families, and their communities. Just call me. Okay, I'm off my soapbox. So now you know about the editorial heard round the world, and from that, the Choosing Wisely campaign was born with the goal to spark conversations between patients and providers about what tests, treatments, and procedures are necessary. It involved 80 specialty societies, including 16 pediatric subspecialties, and the campaign resulted in over 700 recommendations. The campaign reached over 30 countries and was published in over 300 academic journals. Before we get to the lists, I want to talk about some key people this campaign supports and how the ABIM Foundation did their due diligence to understand the problem. We all know that children are one of the most vulnerable populations. That's why I work for them. They don't have jobs, they can't vote, and sometimes they can't even speak. So they need us to advocate for them. There are other vulnerable populations that need the same advocacy. This includes people in poverty who can represent a number of other additional groups that are often marginalized. People in poverty are more likely to have limited access to healthcare and tend to experience higher morbidity and mortality. The unfortunate double jeopardy of people with government insurance who are uninsured or people of color is that they are more likely to receive less effective care and more ineffective care, which makes them increasingly vulnerable to financial harm caused by unnecessary tests and treatments. This financial harm becomes more toxic when we learn that low-income people of color are 3 times more likely than the general population as a whole to feel disrespected by clinicians. To further pick apart the problem of why we do what we do in failing to judiciously rein in healthcare ordering practices, Perry Undem Research Communication did a deeper dive into unnecessary tests in healthcare using a survey of 600 physicians. They were able to summarize the major reasons that physicians knowingly order unnecessary tests, starting with malpractice concerns, which 52% of respondents agreed was a major cause for their choice. There are several other reasons, which at times I feel could be justified, depending on the case. You know that I'm really interested in diagnostic reasoning and cognitive bias, so some of these answers feel like they need an asterisk for a case-by-case description. For instance, 2 reasons why unnecessary tests were ordered were 1, just to be safe, and 2, wanting more information to reassure myself. Okay, I'd say that an added test is justified if your differential diagnosis remains open and the result of that test will guide your management. It's just that when there's no foundation in the pathophysiology to support getting the test in the first place, that excess ordering really irks me. The list goes on to name several customer service-based reasons. Patients insisting on the test, wanting to keep patients happy, and the respondent felt patients should make the final decision. These are situations where I'm well known by the nursing staff to be an exceptionally slow provider. I will take an extra 5 minutes to educate a caregiver, and I'll probably even cite the article in support of my position on why we should not order a test or treatment. At the center of that conversation is the child, not the parent's worry. Dr. Leon Seltzer has a great quote about cognitive dread. He says, quote, "A primary motivating force in human nature is to avoid anxiety, questionably one of our most distressing emotions. So when given the opportunity, we'd rather go ahead and process it than be paralyzed by it." End quote. You've heard me say it before. Take an extra 5 minutes to explain your reasoning in terms the caregiver can understand, to make them a partner in the care plan, rather than being an authority in healthcare. If these added tests and treatments have the potential for harm, you are not supporting their anxiety by adding risk to it. The list of reasons ends with not enough time for patients, a fee-for-service system, and new technology in practice. While not having enough time garners my sympathy in an effort to reclaim some efficiency for the visit, the last two infuriate me because it really does feel like exploitation, especially when partnered with the fact that a majority of respondents, so 57%, admitted that they talk about the costs of tests and procedures half of the time or less. Remember that the goal of this campaign was to spark conversation, not end waste entirely. Our practice is an art, and our patients and their families have a stake in the decisions we make. These lists are not prescriptive. They're guides and conversation starters, and part of the health equity lens that is so desperately needed in each patient encounter to make sure that the recommended management is feasible for families. If the goal is better outcomes for children, why would we order a test that doesn't make a difference? Why would we offer a treatment that can cause harm? Just because it's what we've always done? Make decisions based on current evidence, not from a lack of your foundational knowledge or influence from external sources. The campaign created posters with 5 questions for every patient to ask their provider. Do I really need this test or procedure? What are the risks and side effects? Are there simpler, safer options? What happens if I don't do anything? How much does it cost, and will my insurance pay for it? Just imagine the kind of trust and allyship that can be built with honest conversations around these core elements of our patients' health. I hope that you'll join us next time when we'll dive into the American Academy of Pediatrics Choosing Wisely lists as we process a case that I have seen so many times in the emergency department: a school-aged child with syncope. Don't forget to like and follow the Peds NP, where we discuss the practical application of evidence-based practice in a conversational way that helps you synthesize and transform the best practices from the literature into your clinical bedside skills. Thanks to the acute care P&P faculty who reviewed this episode. The Peds NP is built on grassroots foundations in communities of interest, so share it with a colleague, pass it along to your classmates, and text it to a friend. There are no relevant disclosures for this episode of the Peds NP. Follow me on Instagram at the Peds NP Podcast. Email me at thepedsnp@gmail.com. And remember, this isn't just a podcast. Making good choices matters for the kids. I'm Becky Carson. Take care.
Free audio post-production by alphonic.com.